title of the session is The Role of Digital Solutions in Health to Advance the New Public Health Order, Part B, Data Sharing and Informatics. So, I mean, by profession, when I'm not here being an MC, I'm an actuary and I work in data. So I think this is something that I find really interesting. I hope you all find it interesting because it's got a big part to play in our future. I'm just going to introduce the moderator. So it's Miss Carolina Maskovich. If I showed you the spelling of her surname versus the way you pronounce it, I don't see how the two are related. She's got a very impressive profile. She's the Innovation Director at ECH Alliance. So from Brian, who was here before, they work together. And she's got lots of stuff on her profile, but the one I do find interesting is she has a Master's in Futures Studies. If you haven't come across that, please have a look. It's the kind of thing we should probably all be thinking about studying. Welcome.
Thank you so much for the very kind introduction. Yes, indeed, future studies is something you can study, and it's serious, piece of research. So people do also PhD on that, and of course, it has something to do with strategic planning, future scenario, something that we surely should also explore when we discuss the topics like today. But yeah, let me introduce the panel. I have a pleasure to moderate this important discussion. As it was said, I work at the ECH Alliance as the Innovation Director, and I also have a background in work for the advocacy organization that works with the personal data sharing. Of course, data is a very, very big discussion currently in the European Union, but I come here very humble and eager to learn and listen from our fantastic speakers. So let me invite to the stage Mr. Cyril Sek, who is the strategy advisor at Africa CDC. Hello. Then we have Mr. Eyong Ebai, who is executive director and general manager, GE Healthcare, Sub-Saharan Africa, Europe, Middle East, and Africa. Just Africa. Mrs. Annika Krugel, client and solutions director, Vantage Health Technologies, part of the Broad Reach Group. Yes, Annika. And Edwin Mulva, director and team lead at Digital Solutions Village Reach. And I wonder if we have with us Mr. Emmanuel Njoku. We saw him. Yes. Hi, Emmanuel. Welcome. Emmanuel is regional manager at the B Medical Systems and chairman of Emma Njoku Foundation. So thank you all for being here. And maybe just a couple of words about the session. I will ask each of our speakers to introduce themselves and say what brings them to the session. They will have some short interventions, and then I also invite you to the session. In this session, we of course look into health data and informatics and the role of the private sector in advancing the African new public health order. We will hear from Cyril some words what new order means. I think that after today we are well aware, but just to recap and to set the scene. And of course we will discuss issues related to the interoperability standards, to the data governance, to the equity, and how actually we can get the best out of the data and really utilize the potential of the health data for health for all. Just about coming back to the future studies, and we did at the ECH Alliance some work with the stakeholders. We ran a series of the so-called futures scenarios, so the future workshops, so the workshops that explore different futures. And then you choose what is the preferred future, what is the probable future, and how to work towards this vision. And when it comes to health data, we learned that people would like their preferred vision of the future when it comes to health data is that the data runs smoothly within healthcare system. So it actually, wherever you go, to whichever health provider you go, your data is there and you can get good follow-up and good services. And data also goes across the borders, but of course in a safe, secure way and in a way that we as the users and we as the owners, we actually feel in control. So this is something that came out from our work, but I wonder, and I'm looking forward to hear from our speakers, what is their take on this topic. And as I said, let's run just a short round of introduction where our speakers will tell us what is the perspective they're bringing to the session. So we'll start from Cyril.
So I'll be speaking as a policy advisor from this very young organization.
Brilliant, thank you. And what about Young?
Yeah, hi, good evening, and hopefully everyone's awake. So my name's Eyong Ibaya, and I lead the GE Healthcare business for Africa. I come from an industry background. GE Healthcare is a technology and digital innovator. We have a desire and a need for the healthcare systems to be digitized, connected, so that we can, one, provide imaging data across multiple healthcare systems, across borders. We need our systems that we deploy, our CTs, our MRIs, and etc., to be connected so that we're able to service them and predict failures so that we can keep uptime to a maximum. We also need those systems to be connected through digital infrastructure to allow us to be able to train and develop capacity so that people that have invested in our technology can get the maximum from it. As we all know, we have a human resource crisis across the continent. And again, systems that are connected can allow for reporting to happen anywhere on the planet to get second opinions or even first opinions, etc. So my interest in digitalization of the healthcare system is that it's the only way we're going to be able to improve access, reduce cost, and deal with the human resource crisis that we're living through at the moment.
Perfect. Thank you so much. And then to Annika.
Hello. Yeah. All right. Hi, everyone. Good afternoon. So like Carolina mentioned, my name is Annika. I am a client director in the delivery function of Vantage Health Technologies. So the lens that I'm bringing today, it really comes from supporting clients across Africa in doing what they're doing better using technology. So that is my perspective. And what brings me here today is really just to connect, to listen, and to absorb all of your experiences from working in a similar space. So what a pleasure to be here.
Perfect. Thank you so much and welcome. And then Edwin.
Good afternoon, everyone, or is it good evening? Edwin Muller with Village Reach, Director and Team Lead for the Digital Solutions Global Technical Team. Village Reach, we like to call ourselves a global health innovator. We work very closely with governments and other partners to build solutions that solve critical gaps in the health sector in low resource settings, focusing mainly on the last mile. My background is software engineering, but I've worked in many sectors: health, microfinance, science research. But for the last, I would say, 10 years, I've mainly focused on digital health. I'm here to learn because this sector evolves very, very quickly. You blink your eye and there's something new. And I know a lot of people have experience here, and I'm hoping to also share in that learning process by sharing some of the work that we're doing, some of my experience, and hoping that that will contribute to the learning process.
Brilliant. Thank you so much. And then last but not least, Emmanuel.
Thank you very much. Good afternoon, everyone. My name is Iman Joko. I represent B Medical Systems, a company based in Luxembourg. Many years ago, we invented the cold chain technology, precisely in 1973, as a way of supporting WHO to maintain vaccine integrity across the world. And over the years, we have built on this technology always being first, trying to leverage on innovative technology, saving human lives. And today I'm here to talk about the remote temperature monitoring device which we have introduced in the last 5 years that helps you to have real-time monitoring of your vaccines wherever they may be, anywhere in the world, so as to ensure the integrity of vaccines and vaccine-related products. Thank you very much.
I have some questions also prepared to our panel, but based on the previous discussions, I see that you are a very engaged audience. So yeah, I'm counting on you also with questions to the panel later. Sure. Sir.
So don't be afraid, only 4 or 5 slides. What I want to do here is provide you with basically the background, the baseline, where we're starting from and what we would like to achieve as Africa CDC in the field of digital health. So first of all, Africa CDC is a very young organization, and this is a very crowded space, right? So we spoke earlier today about this competition that sometimes becomes a bottleneck, but our approach is really to work with all the partners. At least this is our approach within the digital health field. There's so many great ideas and solutions everywhere. We want to accelerate, we want to amplify, we want to make sure that all those ideas can reach the full potential throughout the continent. But here, what you see on the screen is basically those 4 pillars that we built the strategy on. So first of all, there is the Agenda 63, and if you're not aware of it, I invite you to have a look at it, read it. This is very, this is a vision that we all share here. I mean, we've had discussions this morning, yesterday. It's about the integration of the 55 countries, basically. And it's about, in the field of health, making sure that our citizens are productive and live healthy lives. Then there is the new Africa Public Health Order. You've seen the 5 pillars. I don't have so much time. They're also published online. They're extremely important because they changed the game. It was not that easy to go and to go public about that. But we did it, and my colleague earlier today, you could see that he wanted even to go further. Then there is the Africa CDC strategic plan, and we are in the process of publishing a new plan. You may know that we have a new DG, and in the next few weeks or maybe month, we'll have a new 5-year strategic plan. And then there are plenty of good practices throughout that we identified through many discussions. Yeah, and our scope, it's basically the 55. I heard 54, I heard 53. No, it's 55 countries. And what we bring to the table is basically our convening power, the fact that we have direct connections with ministries of health throughout the 55 countries, and that our mandate is pretty wide. It goes beyond emergencies. Many people saw us in the field of public health emergencies, both preparedness and response, but we also need to support labs. We also need to support surveillance. And we also want to make sure that African citizens can live longer lives. So next slide. I mean, nothing new here. It's more of a summary. Those are the benefits from digital solutions. So we usually say that digital solutions provide accessibility, affordability, and quality, but there is so much more we can gain from them, from leveraging them properly. And what is important is that through those technologies, I will not go through all of them, I'll let you read them, we can actually leapfrog. You know, yesterday we had this discussion with the colleague from Sierra Leone, and she was telling us, well, you know, in Sierra Leone, it is so complicated because the roads are not okay, the electricity is not okay, nothing works, and we need to go through each and every of those tiny steps before we can deliver and achieve something. We believe we can leapfrog. We believe we need to change the systems and make sure that through the agile use of those technologies, stronger benefits could be provided to African citizens. And anyway, this is the only way. Because it will take many, many years, maybe not 400, but it would take many years to fill the gap. So let's move to the next one. I will not go through all of it, but I will let you read it, and you will have the slides if you want them. This is the vision, both for the internal processes that I mentioned earlier and the value propositions to member states, and our mission. But I will read the mission. Africa CDC collaborates with Africa Union member states and global health organizations to provide guidance and services that help them build nationwide and interoperable digital health systems that contribute to healthier and productive citizens of Africa. This is extremely long, but this is the process of conversations, workshops with representatives from member states, with more than 75 organizations, and this is the place where all of the stakeholders see us. This is what they want from us, and this is what we will try to bring. Let's move to the next one. Guiding principles. The one you see in the middle are extremely important. The one you see around are cross-cutting. And we want to basically learn from what already exists and push it forward. Okay, so the next two slides are where the meat is. So those are the 7 objectives of our strategy, digital health strategy. The first one is to make sure that all the 55 member states have a strong strategy, to develop their system, and they have the good governance mechanisms. So what you see on those slides is basically the objective here, and then what we will bring. Then the second one is to make sure that all those solutions, all those pilots that we find everywhere, and so many of you are actually pushing some solutions, that we actually analyze them and provide some guidance to the member states so that they don't have to start all over again analyzing them. The third one is about the workforce development. So we want to make sure that both the clinical and non-clinical staff has the capacity that is required to push health and public health. Then there is public health or public infrastructure and goods. We want to make sure that there is interoperability, that the whole infrastructure, both at the member state level and at the continent level, can be integrated. Infrastructure and connectivity, we said it many times, without electricity, without connectivity, there is no digital solution. And then we want to make sure, this is actually the last one here, the number 6 is actually quite important. We want to make sure, and this is very well aligned with the new public health order. I need to be quicker. No. 1 minute. Yeah. We want to make sure that startups, unicorns, can flourish here. Then the last one is about our internal processes, and we're going through that. It is also important to be effective internally to support the member states. Last slide now. So those are some of the programs that we're currently pushing that are completely aligned with the strategy that I shared earlier. So the ones in green basically have, a concept note, a team, some kind of budget. The ones in orange are almost there, but not yet. And the one in gray are still waiting to be launched. This is a work in progress. We are using a very agile methodology. So in each and every of those programs, we have organizations, that provide either in-kind support, expertise, or funds. And we're in the process of putting together very detailed project plans. Then what we'll do is basically resource mobilize and start the implementation. Let me finish here.
Perfect. Thank you so much, Cyril, for this inspiring presentation and definitely very ambitious proposal, very ambitious vision. We can also discuss that, and I have a couple of follow-up questions. But before going there, let's hear from our next speaker, from Eyung. Eyung, yes. Yeah.
Okay.
Thank you.
Thank you.
So different perspective, more industry perspective this time.
I was going to say, so from the policy side to the actual implementation and execution side. So as I mentioned, I lead GE Healthcare for Africa, and our purpose is to create a world where healthcare has no limits. And I think this resonates very much in our journey on what we're trying to achieve in Africa. We're a medical technology and digital manufacturer. We operate across the entire healthcare pyramid, from primary healthcare through to specialty care, mono-specialty care, multi-specialty care. So we can provide, the most simple handheld ultrasound, or we can supply the most cutting-edge nuclear medicine systems. And when I was looking at this and we're, thinking this through and looking at the new order's 5 priorities, GE Healthcare probably operates across 3 of the 5. Unfortunately, we don't manufacture anything on the continent. I would love to manufacture CTs or MRIs in Africa, but unfortunately, we don't have the scale to be able to do that in an affordable way. So maybe with the work of the CDC and the Africa Free Trade Organization and a more robust African Union, if we can get 55 countries into a coordinated effort, then maybe we could start rivaling China, India, in these larger mono economies where we currently do manufacture, because we've got the scale. We need to bring scale to Africa. So hopefully the journey from a policy side will lead to that. But unfortunately, I can't talk to manufacturing locally. But I can talk to localization of our organization. So we have 7 offices across Africa, 3 major offices here in Johannesburg, Lagos, and in Kenya. And each of those offices where we provide commercial activities, clinical applications, modality specialization, logistics, and all the things that you need to run a business, they are all run by local Kenyans, Nigerians, or South Africans. I think I'm the 0.1 in South Africa that I live in, that I'm not South African, but the rest of 99.1% of my team is South African in South Africa. 100% in Nigeria are Nigerians, 100% in Kenya are Kenyans. So we've localized our operations to get as close to the communities that we serve. So I think that's my take on the local manufacturing side. It's more about local resourcing. The other one that I can't talk to is around increase on domestic resources in health security. I'll leave that to other experts. But where I can talk to is around strengthening public health institutions. And I look at this from an infrastructure perspective. We've been very active in deploying large-scale healthcare infrastructure programs across multiple countries in the continent to improve access. So you may know of the MES program in Kenya. You may know of the national healthcare infrastructure rollout happening in Mozambique or in Zambia. You may know of what's happening in Tanzania. Again, it's a national infrastructure rollout program where they're taking targeted medical equipment and deploying it on a national scale to bring standardization to those markets. And this is really important because if you don't standardize, it's very difficult to maintain systems, and it's even more difficult to actually train the workforce. Because if you have a different system in a different part of the country, you're constantly having to train different people on different ways to do things. If you've got standardization, you can train clinical workers or healthcare workers And they can go to any part of the country and be able to operate those systems. And it allows for greater mobility. It means you can train at scale, and you can also build capabilities and clinical applications capabilities at scale when you standardize. So I'm a strong believer in national infrastructure healthcare programs, and how they work is by connecting them, right? So you can have centers or hubs of excellence despite having a national program. So those far-flung parts of whatever country we're referring to across Africa can be served by experts where the expert doesn't necessarily have to be in that point or that place. So digitalization of large-scale healthcare infrastructure, I think, is super important in the strengthening of healthcare or public health institutions. The second area is around workforce, and I've touched on it, around the public health workforce. We have an exodus of clinical talent leaving the continent at the moment. In my Nigeria office, I have a turnover of about 25%, and there's a little piece of Canada that probably has that 25% of my team chilling out at the moment in Canada, because it was all about Canada. Then it's now all about the UK. So UK are sort of saying, we don't want any Europeans, but we're going to bring lots of Africans now under Brexit. So there is a huge crisis on our people, and they're being dragged away from our continent. That's leaving us in a very difficult position. Again, the only way you're going to be able to manage through this is by digitalization, connectivity, to be able to provide and train the healthcare workforce in the country, right? So I think that's really important, and it's a very important part of what we do. And also the other piece around this, and I see lots of doctors around the room. My mum would have liked me to be a doctor, but unfortunately didn't quite get the grades. I was too busy partying. But task shifting. Whenever I talk about task shifting on the continent, I get lots of stares. Sorry, it's the only way forward, right? You can't have a doctor in every location that we need one. You can't have a physio in every location that you need one. You can't have a midwife in every location you need one. You're going to have to task shift. And an organization like GE can provide the appropriate adaptive technologies plus the training of people that technically would not have been able to provide those services historically to be able to do those. And we've done this in Kaduna, we've done this across Ghana, we've done this across Ethiopia with our Vscan and our primary and referral care programs. And that enables you to utilize the workforce that you have to be able to deliver for the healthcare system and therefore improve public health. And then the fifth one around respectful and action-orientated partnerships. I see my role in Africa as a convener and an integrator of the healthcare ecosystem. Yes, I lead a commercial organization that provides technical and innovative technical imaging solutions. But if I don't have a hospital, or if I don't have a primary healthcare center, I can't deploy anything. We can't treat anybody. So I'm now partly a hospital developer, unfortunately. The other side of it is if you don't have any money, you can't build the things. So now I'm a bit of a financier as well, and we're working with Exim banks, we're working with development organizations to be able to bring financing, affordable, sustainable financing solutions to help governments build their infrastructure. And I'm also an educator as well now, so we have to train people to utilize the equipment that we provide. So now we're having to build our education muscle to be able to train not just face-to-face, but also through digital technology where we can train remotely from anywhere in the world to improve the skills and the talent of the people that are in the facilities that we operate in. So for me, that's the key role of this. And the final piece is related to healthcare technology, African-based startups. What is a US multinational company doing messing around with startups on the African continent? They are the keys to be able to help us to solve the problems that we have in this continent. It's not going to come from Chicago or Boston. It's going to come from Lagos. It's going to come from Nairobi. It's going to come from Johannesburg and all the other areas where you see hot or incubators of healthcare technology companies that are developing solutions for the countries that they actually are based in. And I'm now bringing those to the ecosystem to support us with our play around building out healthcare and healthcare infrastructure across the continent. So that's my take on this. Very much industrial, very much practical. The policies is very important, but we also need to get stuff done. And we will always get ahead of the policy, but it's important that the policy catches up with us at some point. But we're not going to wait for the policy. We're going to get it done first. To be discussed.
To be discussed, for sure. Thank you so much, Eoin, for this perspective. Again, very, very rich and lots of work being done.
What I'm going to talk about today is really grounded in the experience of the Broadreach Group. So we have 20 years of implementing large-scale funded health development programs through a Broadreach Health Development. And then, of course, we got my business unit, Vantage, which provides technology-enabled solutions to those who are running large-scale program. So, similar to Cyril, I'm also going to lead with our mission statement because I think it does provide a thread that I would like to carry through my presentation today, and that is that we harness technology and innovation that empowers human action. And I really want to emphasize that last piece about human action, because what we've seen over the years working with data and technology as well as provision of services is that dashboards don't actually do the work, people do. This might sound like a pretty obvious statement, a simplified view of the world, but what we've seen and observed is really significant investment in really sophisticated analytics tool. We're talking about real-time data, dashboards. I mean, I love them, don't get me wrong. Of course, we've also seen the application of AI being more broad. More recently, generative AI, ChatGPT, has taken the world by storm. But on the other hand, what we've also observed is that a lot of people and organizations are not able to utilize the technologies or the data or the tools that they have available to the maximum benefit. And the reasons, it could be different reasons. I think a lot of the time, tools are just too complicated and you don't know what to do with it. You look at this thing and you go, I don't know what to do, I'm just going to put it down. I think a lot of the time we have a one-size-fits-all kind of approach, and it's not relevant to what you're doing on any given day, so you're just not actually going to use it. And I think importantly, and it kind of sums up those two first challenges, is that if the data that you have is not helping you to make informed decisions, you're not going to use them, and it's certainly not going to drive any of the impact that we are hoping these technologies will allow us to do. So, what do we do about that? So, the way that we think about our solutions is really centered on the user. So, it's a human-centered design process, understanding who's going to use this thing, what business outcomes are they driving towards, what kind of challenges are they up against, and therefore what are their needs from this data or the technology tool we are developing. And once you get a feel for that, we overlay it with the 4 critical levers that we think are super important to pull if you want to improve program performance. The first one relates to adaptive management. So, in other words, do you have the right information to make the right decision at the right time? The second one relates to your workforce performance. So are you able to empower your workforce and your managers to drive performance from an individual level and up throughout the organization? The third one relates to patient outcomes. So do you have data and insights that can allow you to get ahead of a problem before it becomes a problem? And then lastly, you know, with us working in funded HIV and TB programs predominantly, the reporting capability is super important. So do you have the right capability to provide ad hoc analytics support and also meet your reporting requirements? So I'm going to try to provide a bit more of a practical example of these concepts so it doesn't become an academic presentation here. And this is based on our experience in implementing one of our solutions called the Patient Retention Solution. And I think for me, this is a great example of technology coming together with human action to drive impact. So the solution was developed as a means to use technology. Well, it's a machine learning algorithm and predictive analytics to flag clients who are at high risk of defaulting on their next clinic appointment. Now, that's great, and you get a list of these high-risk profile clients, but unless you do something about that, you kind of miss half of the equation. You won't be able to drive that impact. So the second part of the solution is really around that. So once you have identified where to prioritize your efforts, you need to implement proactive engagements to stop the default from happening. So if we think back to what I just mentioned around understanding the users and what they need and the kind of challenges in order to achieve the outcome, which of course is improved retention in care, for this context, it's, I think it's been mentioned already, you know, we have limited resources. We just don't have enough people to throw at the problem. And we also often don't know how to focus the limited resources that we do have. So this is really where technology can come in and provide a tool to prioritize where to focus your efforts. So this is where the list of high-risk clients come in. What we've also seen is that many organizations struggle to understand which intervention is actually driving impact, which are the most successful interventions in order for me to achieve what I need to achieve. So that's why this solution has a different component to it as well, which attaches to the list of high-risk profile clients, which captures feedback on interventions. What did you do? When did you do it? How did you do it? What was the outcome? And so on. And then we close the feedback loop by mapping that information to the patient status at the end of the month. So you can really see this is what I did, and this is where we landed in terms of retaining these patients in care. And we've seen some really great outcomes from working with clients who are implementing this solution. One example is one client was able to observe an overall appointment adherence increasing from 73% to 80%. And another client was able to document an 89% appointment adherence amongst the clients who were on the high-risk profile list and who received a proactive intervention, compared to the clients on the list who did not receive an intervention, and their adherence was at 51%. So these findings are really quite significant, and I encourage you to head over to our website if you want to read more, or catch me afterwards, and I can direct you around where to find more information. But to wrap things up, I would like to share with you what excites us about the future. And I think, to put it simply, I think what we see as the future world of work is really moving from a place where you know what's happening. So I can see what is happening right now, to a place where you know what you need to do about it and you know how to do it. And I think that data and technology can play a really important role here in providing those prescriptive suggestions and the next best actions, which move beyond just telling you where to prioritize your efforts, but they also tell you how to do it and when to do it and who should do it. And I think if we can find ourselves in that space, then we can really ensure that our mission statement that I started off with can be realized around harnessing data and technology to empower action to drive improved health outcomes. Thank you. 1 minute to spare.
Thank you so much. I'd also like to share some of the work that we're doing and to show practically how we are using data and informatics to impact health outcomes. I do have a few slides I'd like to use to speak about this. Next slide, please. So just briefly about Village Reach. Village Reach, we work across a large number of African countries to ensure that primary healthcare delivery systems are responsive to the needs of the underreached. We have worked across 22 countries in Africa, 7 of which we have presence, either permanent or semi-permanent presence, where we work with government. Government is the center of everything that we do, but we also do a lot of work with partners that support government to strengthen health systems. And in these countries, we do have a global technical team. We form very strong partnerships with organizations that support governments. So that's what we do. And our approach is to identify gaps in the health systems, co-create solutions with government, test them. If we see that there's impact, we scale them up nationally. And if we, at scale, if we still find that they're impactful, we transition those solutions to government, let government run those solutions, and then we focus our energies on looking for more problems to solve or build more solutions that can solve, but still continue to provide some level of technical assistance to government to ensure that these solutions are sustained. So on that slide, I'm just showing some of our impact numbers. We have helped provide access to over 70 million people in Sub-Saharan Africa and supported almost 12,000 healthcare workers with the ability to deliver products and quality healthcare services in the work that they do, especially accessing people who typically have challenges getting access to the health system, and assisting the delivery of health products over in 3,000 or so health facilities across different countries in Africa. So next slide, please. So the focus, when we were coming for this talk, we wanted to focus on how digital health can be transformative and in advancing healthcare delivery and public health outcomes. And I wanted to use one of the solutions that we have co-created with government to show how we are doing this in a practical fashion. Next slide, please. So this is Health Center by Phone. We like calling it a health center in every home. And it's an integrated telehealth service, both a hotline and messaging service that can be accessed by communities, health workers, and governments. The idea here is that, and when we were at the Africa Health Tech Summit, our friend Phil Sinjibana talked about the M-Pesa moment. If I can wake up at 2 a.m. and send money to my mother in the village, through mobile banking, the opportunity is there to do the same with healthcare. I should be able to access the health system anytime I want from wherever I am. If I'm at home, if I'm at work, if I'm out in the market doing something as an emergency, I need to be able to access the hotline. And because of mobile technology and the penetration we have in the African continent, the opportunity is there. So for Health Center by Phone, what it is, like I said, it came out of an idea from the community who are implementing a maternal child health intervention in Malawi, and committee said, if we had this mechanism where we can actually call in and get information about the problems that we have as mothers, that could really help us to be informed and know how to deal with some of the issues that are creating barriers for us accessing healthcare. So we worked with the Malawi government and other partners like Viamo, Reach Digital Health, to develop this solution over a 10-year period. Began with maternal health information, and over time, over a 10-year period, the platform allows you to get information for different health verticals, and somebody can call in and talk to a health worker at the end of the line. You can use chat and USSD to access the same service. You can call and listen to a pre-recorded message that's giving you information about a topic that of interest to you. There's the part of telemedicine where someone can get access to specialized access to care from a specialist that's not available at a very low level health facility. But there's also the part of health workers getting remote learning. If government can, very quickly disseminate new policies to health workers, if they need to do that, if people need to be trained on certain topics, they can do that remotely. And then for government, this platform allows them to collect a lot of data that they can use to identify outbreaks or help them or respond to emergencies. Just recently, this year, practical cases, we found that this platform helped the government identify an outbreak of typhoid in a couple of districts in Malawi, and it was also very instrumental in helping to respond to Cyclone Freddy that really ravaged the southern part of Malawi. So this platform really helped with that. Next slide. So I just wanted to use the next two slides to just demonstrate how this platform actually does affect the patient journey. So this is a fictitious character, Tiwonge. She's a pregnant woman in rural Malawi. She's married with 3 children. There's one away, low socioeconomic status. Tiwonge does not go to the health facility if she does not feel sick. She misses her ANC clinic, appointments if she's not feeling too well, because the nearest facility is 5 kilometers away. The one that has specialized services is 7 kilometers away. So she doesn't go there if she is not feeling well, because she has to go until the farm. She has children to take care of. The husband, she relies a lot on the husband for decision making and things like that. So Tiwonge does have access to a mobile phone. She's aware that Health Center by Phone exists because of the government has sensitized the public about that facility. So next slide, please. So this shows the patient journey and how it gets impacted by this platform. So Tiwonge is able to call in or access the service through calling in. She can listen to voice messages, or she can access it through chat. But the healthcare workers are also capacitated to be able to manage pregnancies because they have access to this system. Now, Tiwonge, who typically does not go to get ANC services, gets motivated because they use the system to send them messages that remind them of appointments, and also motivation messages that allow them to realize the importance of going for the ANC clinic. So she's predisposed to, because of these interventions, she can make a decision to actually go and seek care. But when she feels something is off, she could use the platform to call and speak to health worker and say, hey, I'm feeling this and this way. Do I need to go to the health facility? And if she saw that she needs to go to the health facility, she can now go 5 kilometers from where she is and see get some services at the health center. At the health center, which is a dispensary, if they don't have an OBGYN specialist, the healthcare worker at the facility can use the same service to get access to specialized service in a referral facility in the city. And through that, they're able to know whether she needs to go for specialized services to the city or she doesn't do that. And in case that she doesn't have to do that, they can manage her at that facility after being directed by the specialist in the city. And because the platform is available for them. So Tiwonge is able to go home after getting the service at the health facility, but she has gotten specialized care because of the fact that at the dispensary level they're able to access this platform. And there are some times where she doesn't have to go because she's been told you don't really need to go to the facility. She doesn't have to travel many kilometers away to go for specialized care because the lower facility can help her get that. Now, in the whole process, the government is also able to see through the data that's collected how the service is being provided, whether it's good quality or not. There's a feedback mechanism that allows Tiwonge to give feedback to the facility to say, I'm happy with the service or not happy because of ABCD. And the software, now the data triangulation piece comes in. Next slide. So these are just some numbers to show the impact of a service like this. During COVID, there was a spike, there was a 540% increase in calls when the COVID pandemic came up, because by the time COVID was starting, the national hotline had already been transitioned to government. So they leveraged on that to manage misinformation and give verified information to the public. Next slide, please. Next slide, please. I just want to wrap up very quickly, there's a amount of time, but the next 2 slides I wanted to show also part of the work they're doing and using digital tools, how we're able to help governments respond to polio outbreaks in some cases. And the next slide after that shows how in Mozambique, using a similar platform, it's called Alovida, people are able to call in, next slide please, people are able to call into, so if a sample is found somewhere, somebody can call, health worker can call the service and say, hey, there's a sample that I found of polio in this facility. They trigger the carrier to come and pick up the sample and send it to the lab where it needs to get tested. So thank you for that. I had to last 2 slides, but thank you for listening.
Thank you so much, Edwin. And congratulations. I think with the problem and limits on the access to healthcare we experience all over the world, I think the Health Center by Fundus is really something I wish I could also see in my country. So thank you so much. And then Emmanuel, we invite you to complement the story with your perspective and sharing your work.
Thank you very much, Carolina. Can we go to the first slide, please? So we are from B Medical System, a company based in Luxembourg, and we are a manufacturing company. We design and manufacture solutions to the healthcare, especially in vaccine cold chain, blood management, and medical refrigeration. Next slide, please. So, and this we have been doing over the years. We invest a lot of money in research and development, and that is why we are continually innovating and bringing solutions. During COVID, most of the ultra-low freezers that had to be used for the Pfizer vaccine had to be produced in Luxembourg. Go to the next slide, please. Now, we are talking about Africa here, bringing about the practical solutions. As we all know, Africa is, having a lot of problems, and every time we talk about Africa, we talk about problems, but it's a fact of life. So let's not get bored with the problems. But in the healthcare in Africa, we know the inaccessibility to healthcare by member states. So many countries in Africa still don't have good access to healthcare. The people that live, especially in the rural areas, find it difficult to access good quality healthcare. Inadequate healthcare infrastructure, funding has always been the problem, planning and all the related issues of logistics. Serious leadership and governance challenge, lack of cooperation and partnership among member states. So many countries in Africa could have been doing better if they had partnered with member states. But because so many people choose to go it alone, so they achieve very little. Extreme shortages of skilled personnel. Africa, we are talking about 400 years here, but we could do better, right? The personnel is not there. And we also have the problem of brain drain. Those who manage to go to school can't get good pay, so they are forced to seek greener pastures outside African continent. We also have corruption in the sector that everybody knows, reluctance in adopting modern technology, and poor healthcare funding. So these are some of the problems that has held African healthcare sector down. And what all these things, tell us is that we have to do more. We have to find solutions. So as a private sector, as a business, we are thinking about all these things. So let's go to the next slide. So we are talking about paradigm shift, and what is it? We want to weave it around innovation and technology to find solution to these problems. That is technology's ability to change the world is no longer a foreign concept, but rather a reality unfolding before our own eyes. The digitization of healthcare will give birth to numerous tools and resources that improve healthcare services, which in turn shapes the doctor-patient experience for better and accessible healthcare services. We're also looking at digital health and how it applies to transformation to the health field, incorporating software, hardware, and services under its umbrella. Digital health includes mobile health apps, electronic health records, electronic medical records, as well as personalized medicine. Data is important and needs to be available to patients, healthcare staff, and decision makers in order to avoid the creation of gaps and support provision of services in areas that are underserved. So our sole role is to support equity and provide the leadership which is necessary to create a paradigm shift towards the digitalization of the healthcare services. Next slide. Now, we are using Nigeria as a case study, so this is where we're going to talk about something very practical. I'm sure all of us know about Nigeria. Nigeria is a country, it's about 1 million square kilometers in size. It's got 774 local government areas, a population of, estimated at 250 million at the moment, and over 8,000 wards. So how do you manage healthcare services in this area? Now, our company, B Medical System, focus on what? Vaccine cold chain. So for us to do this, to ensure integrity of vaccine to the last mile, we have to find a solution. If you allow a country like this to jump into the market, buy different products from different vendors, just like Mr. Ayon said, it will be chaos. You know, that is where standardization comes in. And what are we doing with this? Nigeria, for the last 10 years, have adopted B Medical Systems as supplier of cold chain. Today, we have over 30,000 vaccine cold chain refrigerators sitting all across Nigeria. And what has this done for Nigeria? What it has done for Nigeria is that it has enabled the country to scale manpower. We have continually provided training and retraining to healthcare workers at every level, to the last mile. Now, having just a uniform or a standardized product helps the country to leverage on limited resources. It helps the country for planning. It helps the country to save a lot of money. And it helps the country also to retain the available manpower. Now, we developed the remote temperature monitoring device. Every single unit of this 30,000 equipment is equipped with a remote temperature monitoring system. Can we go to the next slide? And this is monitored on the VacLog software. Now, you can see in this, this slide, we're talking about a healthcare facility. Now, look at the map of Nigeria. You see all the green dots. They represent all the healthcare facilities in the country that has a B Medical System. So I'm sure you can count all this, right? So now, we have pulled one particular public health clinic here. And we have brought out the refrigerator there. You can see the VCC ID. You can see the name and the serial number of the equipment. Now, here, you see on this dashboard, the internal temperature of this particular refrigerator, 3.8 degrees. This is a vaccine refrigerator storing at +2 to 8 degrees centigrade. And you can see the external temperature, 28 degrees. Now, the internal temperature is 3.8. Now, if anybody opens this refrigerator, an alarm goes up, and it goes to whoever has access to this system. This is the same thing with the other 30,000 equipment, wherever they may be stored. Now, with this information, you can imagine how much planning, decision, and efficiency a country can achieve in healthcare. And this is what we bring to the table. And we continually improve on this. And this is not just in Nigeria. I'm using Nigeria as a case study. It is the same in Ethiopia, in all the other countries that have adopted this technology. But imagine if you have a whole lot of vendors selling different things. So how many will the country be able to manage? And how can they be efficient with those things? So standardization comes to play here. And this kind of solution can take the healthcare very far. Because you can see every equipment, even from here, I can check from my phone, all these things, equipment that you see on this slide. And this is what we are saying. B Medical System has been a partner in this. And we are continually improving on the technology. Can we go to the next slide? So, and the impact of what we have done, you can see the impact to the patients and to the health institutions. You have a streamlined process, you have secure data, you have improved patient experience and enhanced time management. And for the institution, you have reliable services, accessible health records, real-time health-related data metrics, and improved communication between health practitioners. So, and this plan, our digitalization plan of the vaccine cold chain process in Nigeria has over the years helped transform both technical and operational capacity of public health through the use of web-based remote control device. Can we go to the next slide? So in conclusion, given the existing healthcare challenges and how we have been able to tackle it with digital solutions that we provide, utilization of all healthcare services is a key factor that will expand continental health coverage by eliminating a number of barriers such as cost, complicated access, and lack of quality care, while extending the scope of services in Africa where infrastructure and skilled personnel are scarce or non-existent. Thank you very much.
Thank you, Emmanuel, also for your conclusions, and I think that this is an excellent bridge now to the discussion. And before I open the floor to also questions from the audience, one thing that I keep thinking is you all are doing excellent and really ambitious work, and I'm sure that you cannot do this work alone, and the word of today, I think, is partnerships and collaborations. So I wanted to ask you of your advice or reflection or experience on how the stakeholders from the digital health industry should collaborate to bring the change, to actually not compete with each other, but collaborate and create those advancements. Do you have any messages, something from your experience, or maybe some stories that something didn't go right and you learn from it? Someone?
Okay, here I think the way forward is to say, like the company will say, we save life using innovative technology. So if the goal of every player is to save life, if there is a common goal, if profiteering, money-making, commercialization is not at the center of what is being talked about, then it will be easier to collaborate. okay, if all share the same goal of saving lives, then people, organizations can team up, have tailored solutions that could also be integrated across the product lines. But at the moment, it is all solo efforts. Mm-hmm. And because the spirit of competition is there, it's difficult to integrate.
Okay. Yeah. Jump in.
Yeah, I mean, for me, sharing lessons learned and experiences. Because talking about the 400 years I was talking about previously, if a country has done something and learned lessons and made mistakes and known how to rectify those, then another country that's coming in to try and replace something similar can avoid those mistakes and take a much shorter time to implement. So I think that's one way people can collaborate to ensure that we solve some of these problems, but helping others to do them much quicker than how much would have taken, because we are learning lessons from mistakes that have been made by other countries.
Yeah, maybe I have a few comments. I think we have to take these problems on as an industry, right? So an industry approach to standardization and an industry approach to ensuring that there's interoperability between systems so that tools, applications can be built to talk to different companies that are delivering similar things. That's really the key to be able to do that. And so, the health federations, the industry bodies, et cetera, across the continent are an important engagement with governments to be able to get that standardized approach that we can therefore build applications on, say, the Edison platforms that GE has that can then talk to a range of different solutions that are provided in a specific area.
You want to go?
I'm not going to belabor it because I echo what has been shared already, but I think what you mentioned is really important. I'd like to think that we're all driven by the same purpose. So we'll have to keep that front and center. And I also think that an acknowledgement is needed that we can't all do everything. Like, I'm really good at something and you're really good at something, so why don't we come together and do something even greater together?
Very in line with what was shared, and especially what you just shared, Ian. As Africa CDC, we believe that scale is very often the issue. We have many pilots everywhere. But in order to reach the right size, what is necessary is the integration of our markets. And health data governance at the continental level or even at the regional economic level is critical. Maybe you remember from the last slide that I presented, but there were so many of them, sorry. That there is one project that we love. It is the Data and Innovation Sandbox. So what we want to do with that is to help startups work with sufficient data so that they can prove their concept, so that they can do operational research, so that they can work with sufficient data in a secure environment and discuss with policy makers, because we are important. Without us, there will be no integration and we will remain dwarfs. We want leaders from Africa. Yeah.
For sure, you also policy drives innovation, intervention and investment, right? So funding, yeah. So common goal, sharing lessons learned, standardized approach, common purpose, and integration. So those are your lessons. So I'm sure that now our audience had time to think about your questions. Do you have some questions or comments to our panelists? And if we can get do we have enough mics, or are all the mics on the stage? Okay, thank you. No? Oh, okay. Over there.
Thank you very much to the panelists. It was very informative. I'm Lindsay Stewart-Isherwood. I'm from the WITS Diagnostic Innovation Hub at WITS University. I'm representing Professor Wendy Stevens. So I'm talking more from an academic point of view. We generate our own innovations too, and we've managed to implement a digital innovation at scale in Zambia and South Africa, and it's actually funded by CDC and USAID. We want to know, when you're thinking about the strategy, and probably Mr. Sek, you're probably the best person to address this, what will be taken into consideration for the ministries of health to sustain scaled digital technologies? We talk about affordability, because at the moment it's all funded by PEPFAR, USAID, CDC. How do we then take this vicious funding cycle out of the equation and negotiate with industry partners? Because we're not industry, but CDC and USAID will have the power to negotiate with industry partners on how to, I don't know if you call it standardized, but negotiate the business models to sustain the adopted technologies in the relevant countries. Because I feel for the ministries of health that they get good solutions but then have to let them go because it's just not affordable and accessible, which is what we strive for as an organization.
Thank you so much. This is a great question, and this is what we're facing everywhere, every day. Great innovation that do not find their way to the market. So part of the solution is what I just shared, integration, but this takes time. What we're facing is basically, two big challenges. The first one is change management. And the second one is that actually should come first, is advocacy and making sure that we can prove the value of the propositions that we put forward. And this is best done through business cases with clear metrics that usually in most of our 55 countries, we need to convince from the top down. So at Africa CDC, through our direct connections with ministers of health, we can push some of the solutions, some of the issues, some of the scenarios and options. But also, I'd like to say that there is already so much. I mean, there are so many startups with great products. A big element is to, clean the plate and have some white lists, of products or solutions that have been proven effective in some settings that could be shared across, Africa. So that's what we're trying to do. This is obviously not maybe the only solutions. And that's actually a question that I had for the colleague from Village Reach. I mean, I saw many metrics, but how much does it cost? Whether it's per patient or whether it's per call, how do you actually have those, dollar elements that we can use then to convince?
So before I respond to your question, I just want to contribute to that question to say that I think co-creating these solutions with government right from the beginning is important, because they will get some feel of ownership of that solution, and also talking about sustainability from the very beginning and say, we are going to co-create this with you. The plan is over X number of years, you're going to take ownership. So start preparing government to take over ownership of this system. So when you do that from the beginning, they start looking at policy. Like if you look at Malawi, for example, Chipatala Chamafoni, government owns the system. They pay the workers who are manning those hotlines. They're government employees. It's in their budget. Obviously, we have to continue providing technical assistance. Technology is changing. We have to support. For the part of costing, we are currently doing health economic studies to determine just how much it's costing. We do have numbers on costing, how much it cost us over that period of time to build the solution. A lot of private sector involvement and investment had to go into that. Once government took that over, government is now paying for a large sum of the cost of maintaining that platform. I don't have the numbers offered, but we do have a slide that has those numbers. It's not cheap. But we continue providing support. If let's say now we want to build in AI technology to help with social listening. We have to invest some money to build up a solution, and then over time work with government to see if they can sustain that. But a lot of private sector investment has gone into building that. But once the studies are out that shows the actual cost per patient, we want to be able to share that information.
Thank you so much. Yeah, there are some other questions. Can we get we will go there, and here. Oh, and here. All right. So we have 4 questions and we have 6 minutes, so let's go.
Okay, I'll try to be fast. Thank you, everyone, for the very deep and well thought out conversations that we've had. I have a question for my colleague, Cyril. We talked earlier about innovation and getting, thinking outside the box, getting products to the last mile. And I appreciate, things like the drone, which I think it's genius. But then there are those instances where, like in my case, most of the medicines I provide on behalf of USAID are, like I said, container-wide products, cold chain, antiretroviral medications that require reefer trucks and freezers. So clearly, drones wouldn't work in my capacity. What are some of the things that we've thought about? Because the fact remains, we have infrastructural issues with roads. We need to get the villages, and a drone is not going to take a container full of HIV medication to the village. So have we thought of anything outside of that that can maybe further? Because we're losing a lot of money. I mean, there was an incident in Nigeria not long ago when COVID happened. We lost $1 million in COVID vaccines because of a lack of temperature control. And then most recently with the floods, with the dam in Nigeria, I lost a lot of money there as well because we couldn't find reefer trucks and the roads were closed. There was no access. So what can we do to mitigate those issues that come up? And then my second question is for you, Joko. I am, my brain was spinning. I'm writing as you're talking because I'm actually looking at data logging and geo-tracking for medications. But the remote thing got me because so far what I'm seeing, because of lithium battery requirements for air and ocean, we're limited across the board. So how does your remote tracking work, and do you have a cloud-based system? And if you do have a cloud-based system, what are the mitigations for those areas that don't have perpetual internet? Because someone said there was a data point there that a lot of Africa still doesn't use internet. So what do we do in those instances, and what's the workaround for that? Thank you.
Thank you. Can we just take one more question, and then I'll come back to the panel for the sake of time. I think the other question came from, you? Over there? And then we will come
back. Mine is also to SEC. In creating a whitelist of digital solutions that are endorsed by CDC Africa, I have a 2-part question to this. Are you not potentially limiting new innovations? Like, how often would it be updated, right, so that you're not limiting what is out there? And the second question is, what is the risk of not incorporating Africa-born and bred products? Because what we see often through PEPFAR, USA, CDC funding is that you kind of push, there's a push for digital solutions that are not actually created from and by Africans and work within the African context.
Mm-hmm. Okay, so maybe Cyril,
I'll start.
Respond to those 2 questions, 3, and then we go to...
I'll try to be concise.
Yeah.
So I speak as someone who works in the digital health field, not in the road building business, right? Although I do understand the need for roads. I still believe that there are ways to leapfrog and that we don't need to go through each and every step. But we need to reorganize, and this is difficult. There are winners and losers, so it takes time. That being said, I think our role is not to actually, us, Africa CDC, it's not to put together solutions. It's to create the conditions for solutions to flourish. So through health data governance, making sure that there is security, there is privacy, but that we can still use the data, because without data, which is the new oil, the new gold, the new whatever, we can't have new digital solutions. So we want to make sure that there is a space for innovators to flourish. And hopefully, if they come from the health business, but also maybe from other industries, there will be innovative solutions to bypass some of those very long and complicated issues that we want to solve. Maybe that's not the perfect solution, but this is what we're trying to do. And this is already quite difficult. You can trust me. Now, on your question for the whitelist, sure, it is an arm. It's a wrestling situation. But what we want to avoid is situation like what a few years ago I was in Mali discussing with the Minister of Health. He was so extremely pissed off because NGOs were, speaking back in their countries in Europe, they were sharing the good they would provide to Mali. And this was absolutely not aligned with the priorities of the country. So what we want to avoid is this pilotitis, this disease of pilots everywhere, pushed by donors and philanthropies, and we welcome working with them. But one of the pillars of the new public health order is respectful partnerships. So we want to make sure that when we did the analysis, and we say that this solution makes sense in this context, in this setting, we don't start all over from step one. And your question is, how do we do with innovative solutions? Yes, there should always be an open door, but then you'll have to prove why you changed the game.
So much.
Some countries are already doing that, by the way. Rwanda and Burkina Faso, among others.
Yeah. And then on remote tracking.
Thank you very much. To start with, our equipment, or the remote temperature monitoring device, is based on a cloud managed by a company in Belgium. Now, the systems come with a roaming SIM, so that does not depend on Nigerian communication. All right? So no matter where you install the system, they will pick up, because Nigeria allows roaming of foreign SIMs within the Nigerian jurisdiction. So, and also the equipment or the refrigerators in question, they work 100% on solar. It's called solar direct drives. So they don't need lithium battery to operate. So anytime, any day, anywhere, they are operating. And even when you don't have insulation for up to 10 days, you have autonomy. So they are sustainable. All right? So I think that answers the question there. Then you talk about losing vaccines, COVID vaccines. I'm sure it was not because there was no monitoring. It probably because your COVID vaccines were stored on ultra-low freezers. So apparently for electricity, so that's why you lost your vaccines. But for all the health facilities across Nigeria, they operate on solar direct drives. We recognize early enough that our electricity is not sustainable. So, and this solution is actually dependable. And for the last 10 years, Nigeria have relied on this solution, and we are polio-free. We can proudly tell you that, because vaccines can maintain their integrity all to the last mile. Thank you.
Thank you so much. We had the question here, sir, and there was one more, but all right, and then you. Perfect, thank you.
Yeah, thanks very much to the panelists. Really very, very good presentation. My first question goes to the Tiwonge journey. We're actually implementing a similar program called MomCare, which tracks the pregnancy. And our experiences are very different. One from your side is like sustaining to or scalability to public sector is very easy. In the case of Kenya and other countries, it's not. So anyway, my question is, to what extent do we go with providing technical support during the transition to government? When do you stop? Because our experience is that the government becomes so over-dependent to an extent that they still want you to take care of that child. And then, even if Tiwonge gives that phone call, the experience is that the government will not provide for the entire pregnancy costs. In our case, we had to set up conditional cash transfers to be able to bridge that gap. So I would just like to know whether you also do the same. And how do you ensure that Tiwonge has quality care in spite of all these calls? Then my last question is to Ayong. Thanks very much for the MES, in Kenya. That really made a very, very good support. But one question I would like to ask is, you of course had high-end technology with sophisticated equipment and all that. But what you find in the rest of the ecosystem, the curriculum, they are not trained in those things. So you had to train people as when they came, and that makes institutionalization, quite difficult. And what did you actually do with that volume of data you got from MES for the future?
Thank you, and at the same time, we will take the last question from the lady in the second row.
Thank you. I think it's a general question for the panel, but perhaps more for yourself, Annika. So I'm Nambuza from MSD, and you gave really nice examples of some of the solutions that you've been developing. Just wondering from your experience, what do you do about changing the culture around data? It's really good to have data, but you need to have data for action, results for action. So in your experience, and perhaps yourself, Edwin, you can also come and you mentioned good results in, I think, the government of Malawi with sort of them taking over the program. What was your assessment of their attitudes towards using data for action, and what have you done, or what could you do to drive a culture of using data for action amongst key decision makers and policy makers?
Mm-hmm. That's a perfect last question, I would say. So let's start from the technical support and question to Ayong, and maybe Annika will answer the last question. Yeah. All right. Edwin?
Yeah, thank you for those good questions. I think the first question is about to what extent do you provide technical assistance to government. So in the case of Malawi Ministry of Health has a digital health department that is equipped by people who have technical expertise in digital health. I do think that governments need to have some expertise in digital health embedded within government to continue providing government-led technical assistance. We as villages, when we talk to government, we say, I think there's some work that you should just leave to private sector to handle. If you are setting up, if you're setting up in-country data center, government should not be running that. Let the private sector who have expertise to do that, and then government is actually using that service. How do we ensure Tiwonge has quality care? When Tiwonge is calling the call center, it is manned by qualified health workers, and they're able to advise Tiwonge as such. When she goes to a health facility, if that facility does have telemedicine capabilities, then the health worker on the ground is able to get access to a specialist who is somewhere in the referral hospital, and they're able to be guided to ensure that she is well managed. In the event that that facility cannot handle Tiwonge's case, she has to get a referral to the higher level hospital to get that service. So it's not that all services are available at the dispensary level. There are some where you need specialist equipment. She has a complicated case. It requires her to go to a higher level facility. What will happen in that case is that you'll find that there'll be mechanisms, maybe using ambulances and stuff like that, to ensure that she gets to that referral hospital in time and without spending too much time on the road, and that also saves a cost. In Malawi, they are not really giving financial rewards, but I'm looking at the flip side of saving costs. If you don't need to go to a health facility, if you don't need to travel to a referral hospital that's 100 kilometers away, you are saving money. And also, it's also freeing up your time to be able to do other things as opposed to spending time on the road or queuing in the health facility. One thing that this also helps with is that reducing the workload in the health facility. If people are calling in and they don't have to go to the health facility because they can be directed to go to a dispensary to get some medication because they're being triaged by a skilled health worker at the end of the line, then they are decongesting health facilities, and the effect of that is that the people who really have to go to the facility are spending more time with health workers.
All right, thank you.
Yeah, no, thanks for the question. So look, I think on the managed equipment service, and just for people to get the context, it was we deployed radiology systems across 98 hospitals across the 47 counties of Kenya. Very much a standardized approach. Every county had 2 facilities that we built out their radiology department and deployed solutions. Unfortunately, the data piece of that never came to finalization. So, I mean, and we're talking, this was negotiated 9 years ago when we ran a 7-year program. So one of the big learnings I feel from that is around the respectful partnerships piece, right? I just don't think we had the right partners at the time to deliver an integrated digital solution to what we were doing on the equipment side. And I think we've learned from that, and I think the industry's learned from that over time. So picking the right partner that can deliver a solution that makes sense, that is also affordable to the country, because the key to these programs that they have to be sustainable after the funding has gone. And the beauty of the MES was that it was in the budget, right? So it was funded, but we probably could have done it in a more affordable way. And we could have probably saved by utilizing some of the new African-based tech startups that were a little bit more appropriate from a funding or from a cash perspective, right? So I think that's really key. You can't always go with the multinational approach. You've got to go with the ground-up approach, which are typically more affordable. On the training piece, again, great question. On this, we had to build a training center in Nairobi. We had to pay per diems for people to come to those training centers to be trained, right? So we trained biomeds, we trained sonographers. We had to build that into the program, right, to make it sustainable. And typically now when we do these programs, there has to be a training component, a training piece built into it that is also sustainable, because you're always having to retrain over and over again because of the clinical workers leaving the country. So you've got a revolving door. So it has to be consistent and continual for essentially the lifetime of any type of intervention. You've got to keep on training, and you've got to make sure that people are able to utilize the solutions that you're deploying on the ground. But it's got to be, again, integrated into the solution, but at an affordable level. And again, that's why I believe that the digitalization is so important, because you can, we had to bring people from the 47 counties to Nairobi to train them and send them back again, right? If I was doing this again, we wouldn't do that. We would connect through technology to be able to have that training while they're in their locations. Mm-hmm. So I think that's...
Thank you so much. And then there was a question about the cultural change of using data. So Annika, do you want to comment on that? And then Cyril will have one minute, he said, and I will wrap up the session. I know it's late, but thank you for your attention.
Yeah, change management. It's a big one. I think that data problems are often people problems, and I don't mean that in a patronizing way at all. It's just that we need to acknowledge that these sort of things don't just happen. You have to be very deliberate around working with your users so that they can see the value in the solution for them. Like, what's in it for me? What is required of me in order to realize this value? It's like the old saying goes, people, process, technology. You really need those three parts to fit together. And I think you already mentioned it, Edwin, around in the context of working with government and sustainability. I think it's the same when you come in and you want to implement technology, is that you need to start the design process with your users so that they can really get that feel for owning it, for the value that it's going to bring, and sort of how they play a part in that. One of the key resources on any projects that we run is our change manager. Like we would not be successful unless we had those sort of resources on board. But I think it's broader than that. I think change management is often equated with training. Like it's much more than that. It's really about making it something that is intrinsically felt by the users. And it's hard. It's not easy.
Right. And also it requires leadership and change of mindset, the paradigm shift that it was also mentioned. All right, now 30 seconds to Cyril.
30 seconds? That was to get the mic, but now that I have it, you'll see. I want to say that I'm fully aligned with what my three colleagues here to the right just shared. Change management is critical, and I think there are different ways to look at it. Human-centered design is not enough. Very often we need to change organizations. We need to move away from this pyramid system, because sometimes we can just bypass. And one thing that I've seen very efficient in some countries is delivery teams. So new teams that were designed specifically to deliver on a specific objective. Earlier you said, Annika, well, dashboards are not enough, but if they're well designed and if there is transparency, dashboards are extremely efficient tools. And then patient-centric approaches. Whenever the patient has the information and feels like they're not provided why they deserve, they can also apply pressure, more or less gentle, to decision makers. This is important. And the financing, this is a personal opinion now. This is not necessarily the one from Africa CDC. I think we'll have to find new sources of revenue, whether they're from the continent, whether they're taken from, I don't know, planes or different industries. We'll have to find more money. Yeah.
All right. There is a lot of messages, a lot of things to consider. I will just share very briefly that this morning on the immigration, I was talking with the older lady from the Netherlands. She said, oh, you're going to the conference. I've also been working for 50 years with older people, and I was going to those conferences. Nothing changes after that. And I was like, the change is slow. So I hope that this session and all the other sessions that we were part of today will actually accelerate this change. I think we leave this room very inspired. I learned a lot. I would like to thank Africa Health Business for conveying this wonderful opportunity for us to discuss. And let's be those change makers and let's walk the walk. Thank you so much. And yeah.